Hi, this is Travis Pearson doing my journal for week 9 for Mb662. We're supposed to discuss mandatory reporting involving intimate partner violence. I'm just going to read what Idaho law is on this. It says, mandatory reporting in Idaho. Everyone in Idaho is required to report child abuse, neglect, or abandonment. This is like doctors, hospitalists, and everything else. As far as intimate partner violence, we are recorded to contact, let's make sure I read this right, anyone that may have emotional, physical, or verbal abuse from an intimate partner, whether that be man, woman, or whoever they're currently with. Let's see, what are you required? What must you keep confidential? From what I'm understanding, and I'm not the best at this, you're required to report anything that the patient states to you as intimate partner violence, but you're not to speculate on anything that could be or would be. And if the patient doesn't feel safe, you can report that too. But it's kind of like a lot of gray area on this because I haven't experienced it as much in my field. Discuss any past nursing experience you've had with this. The only thing I've had is unfortunately, some female patients that have come in with some pretty rough bruises on them. And when we talk to them about this, I'm like 0 for 6 on females, getting them convinced to, go to the women's shelter, leave this person, do their own thing. By the end of the treatment, most of the time they're like, well, he just was having a bad day, and I think it was partially my fault. They start internalizing it and making it their own faults and forgiving that person because I think they're so entwined into them emotionally, physically, financially for all the wrong reasons, and it's a really bad thing. Okay, that's my experience with that, unfortunately. As a psych NP, how would you approach therapy with a predator who is wanting to change their behaviors? I'm not sure. I would think I would use cognitive behavioral therapy. I mean, that's a tough one because if you are when you have that much anger that you're physically abusing a person, we are going to have to do some pretty extensive training because we have to reprogram. We also have to get probably down to the core root of why you're doing this. If this was past trauma that's been repeated onto you or somebody else, and then the cycle just keeps continuing. I think mostly CBT with a combination of like med management for like a mood stabilizer, because if you're having that kind of anger issues that you get so upset over such little things that you have to resort to violence, we need to kind of get you mellow a little bit and then work on those feelings of anger and hostility towards the other people. Let's see. What's the best therapy modality and why? There's so many different modalities. I just think CBT, just because it's so effective in so many different areas, I like it the best for a lot of these things. I'm not saying that there isn't a lot of different therapies, but I'm just talking about the one that seems to work the most. And it doesn't work the most all the time. It works the most like 30% of the time, and people get out of it what they put into it. So they have to be willing to change for CBT to work the best. Would this person benefit from group therapy? Maybe. I'm not exactly sure. Maybe anger management would be a good thing where they could see what other people are talking about and see how it relates to them. I'm not exactly sure the best answers, but all right, thanks. This is my Unit 9 journal. Thanks, Travis Pearson.